Great. All right. Why don't we get started? Because we said we've got 30 minutes. We've got about nearly 20 people on, which is brilliant. So to all those joining, thank you so much for joining us today, this afternoon. My name's Tamara. I'm the founder of Live Better With. And basically, Live Better With, for those of you who don't know, is a platform that brings together all of the practical support for people, women going through the menopause. And what we do is we try and cover all of the different symptoms that you might be feeling. And in addition to bringing together lots of articles and ideas on products and so on, we also have experts who provide really useful, relevant information. And that is the reason why we are doing this webinar today. We're very lucky to be supported by Diane, who's our menopause nurse and HRT specialist. And so we've long wanted to be able to bring together kind of the actual trusted advice on HRT, what the guidelines are, and all of the different questions from our community that arise. So I'll ask Diane to introduce herself in a second. If you have any questions through this, we've received a lot of questions in advance from our community, so we'll be going through some of those in this next 30 minutes. But if you have a question, you should see the chat button or the Q&A buttons at the bottom of your screen. If you pop your questions into either of those, and we'll keep an eye and we'll try and get through as many as possible in the next half an hour. So thank you again for joining. And Diane, lovely to have another chat with you. Maybe you could just introduce yourself quickly and then we can get on to the webinar.
Okay, my name's Diane Porterfield-Bourne. I'm a nurse practitioner and I specialise in menopause and HRT. I work in the Midlands area. I've been nursing for over 30 years. I have my own business called Born to Care. And it's really about spreading the word about menopause and educating women all around the UK what menopause is, the symptoms and the treatments that they can do to make them better again.
Brilliant. Okay, thank you for the introduction. Can we jump right in then? And can you give us a brief introduction to HRT and what the NICE guidelines are? What do they say? What do the NICE guidelines say about HRT?
Right, okay. HRT is hormone replacement therapy. So fundamentally what it is, it's replacing the hormones that you are now deficient in during the menopause. There are different types of estrogens that we have in our body, and one predominantly we become deficient in it during the menopause. So when you have hormone replacement therapy, it's replacing that hormone that you're now deficient in, or certainly your levels are low enough in which you're producing symptoms of the menopause, which we commonly understand. The NICE guidelines, there are lots and lots of NICE guidelines, and they are for health professionals to follow. They're a guideline, it's not a policy. So it's a guideline for us to follow for safe, effective practice. So if we're uncertain about anything to do with ear pain, abdominal pain, pregnancy, infections, etc., including menopause, we can look onto the NICE guidelines and they will give us very clear instructions of best practice and safe practice of that particular health concern. So it's a platform for us to follow if we're uncertain about a particular area of care. So NICE stands for the National Institute of Health Care Excellence, and the NICE guidelines for menopause were written in November 2015. So they've been around for quite some time now, nearly 5 years. And it's something that, you know, as a health professional, I understand the NICE guidelines on menopause because it's something I have a very strong feeling and passion about caring for. So I understand the NICE guidelines. And I hear from lots of women all the time saying that they've got problems with the NICE guidelines, or they have issues with the GP or health professionals not prescribing them hormone replacement therapy or advising them to have blood tests. I was speaking to a lady today about it. The NICE guidelines are very clear and concise, and the one most important thing I think to get across is that the NICE guidelines, they do advocate hormone replacement therapy to women. That's not that everybody wants to take it, or not everybody can take it, but it's something that we are trying to explain to people that that is the gold standard first line treatment for menopausal symptoms. Because the majority of women, the benefits of taking hormone replacement therapy outweigh the risk factors, because the risk factors are incredibly low. They're there, and they're there with every prescribed medication, but it's weighing up the pros and the cons, the fors and againsts, the benefits and the risks. And so it's very much an individual thing. And the NICE guidelines are very clear with that hormone replacement therapy or menopause management in itself should be individualized. So, you know, what suits one person does not necessarily suit another. Somebody else has health risks, somebody else doesn't. So HRT and certainly menopause advice has to be based on an individual basis. The first thing I wanted to talk about really with the NICE guidelines is that the amount of women that are having blood tests. And I hear this quite often, that GPs are doing blood tests to say whether they're in the menopause, or certainly women are saying, I want my doctor to do a blood test, but they won't do a blood test to tell me if I'm in the menopause. And there isn't a blood test that will tell you that you're in the menopause. Menopause really is defined on symptoms and age, and also your periods as well, your menstrual cycle. If you're 29 complaining about symptoms related to hormone fluctuations, then it's not going to be menopause, or certainly there's going to be some hormone irregularities there, and it's going to need very careful and different management to somebody that is 49 complaining of menopausal symptoms. So the NICE guidelines are quite clear. Anybody under the age of 40 needs blood tests to check for their follicular stimulating hormone and possibly other things as well, because you have to find out if someone's very young, why on earth they're going into the menopause, and they need some very serious professional management of their symptoms, including hormone replacements of some description. If you're 45 and over, you do not need a blood test to diagnose menopause. The blood test will be to check the follicular stimulating hormone, which anybody over the age of 45, it's going to be elevated, it's going to be high. I don't need a blood test to tell me that a 49-year-old lady has high follicular stimulating hormone levels, because it's going to be because of her age. It's really based upon symptom management.
Sorry, Diane, can I just ask if we've had someone ask, a couple of people actually saying that they've been told they'd need a blood test before HRT will be prescribed, and they've, you know, one person says I'm nearly 52 with symptoms, and another saying, yeah, I was told I need a blood test. What should they do or say?
This is really difficult, because this is between yourself and the GP. But guidelines, if it's purely based on menopause, if they want to check for cholesterol or thyroid or any other investigations, that's completely different. But in order to test for menopause, there isn't a blood test for menopause. The FSH test, follicular stimulating hormone, is a very, very small piece of a very large jigsaw puzzle. And, you know, that putting that one piece in the jigsaw puzzle is not going to tell you about menopause. It's based on the person, it's based on symptoms, it's based on age. So if you are over the age of 45, and this is written in the NICE guidelines, it's very clear that blood tests are not indicated for diagnosing menopause.
Okay, thank you for clarity. And we have a couple of questions that have already popped up. If you do decide to take HRT, and you mentioned it deals with the symptoms, does that mean it will lengthen menopause?
This is an interesting one, because this is something that people talk to me all about. It's not about lengthening it, because at the end of the day, when we run out of eggs in our ovaries, that leads us into the menopause. So we suddenly become inability to have children. That's a natural stage. So that's going to happen regardless anyway. So that can happen slightly earlier in our 40s, or maybe even in our early 50s. So that will happen to everybody. So when you take HRT, it doesn't mean that your ovaries are going to suddenly come back to life and you can start to have children. What HRT does is it treats the symptoms of the menopause, which is estrogen deficiency. So you're deficient in estrogen because the ovaries and other parts of your body as well, but predominantly the ovaries, produce estrogen. So when you're no longer producing estrogen by the ovaries, this is when you start to get your symptoms. So what hormone replacement therapy is doing, it's not going to kickstart your ovaries again. That is not going to happen. But the symptoms commonly with menopause are hot flushes, sweats, anxiety, joint pains, insomnia, low libido. What it does is it improves those symptoms, but it also improves your long-term health, predominantly your heart. It has a very positive effect on your heart, on the blood vessels and on the blood. And it's got lots of things that it can do. It can prevent certainly has a good positive effect against certain types of cancers as well, and also osteoporosis. So what you're looking at is the fact that it's not going to start your ovaries, you're not going to prolong anything. Menopause happens, your periods can stop, but all it does is the estrogen is replacing that hormone that's producing the symptoms and the long-term negative effects of your body.
And does that mean that if you take it, your periods will return or become more regular? We've had a couple of questions on that. One person asking and another saying, the HRT I use still gives me periods. Is there an alternative that doesn't do this?
Right, what HRT can do when you first start estrogen replacement, and well, obviously HRT, you can have some bleeding and it can last up for a maximum of 6 months. But that will be what the prescriber will explain all that to you. Depending how old you are, and depending if you're still having fairly regular periods, remembering that the definition of being postmenopausal is when you haven't had a period at all for a year. So if you haven't had a period for, say, 18 months, you're postmenopausal. And so the type of HRT you'll have then will be slightly different. It'll be a different regime to somebody that's still menstruating. So you can still have periods when you start HRT. And you can be having fairly regular periods and have hormone replacement therapy. You would have the two together because you're producing symptoms of estrogen deficiency, hot flushes, night sweats, insomnia, anxiety, lack of confidence, low libido, all these things, vaginal dryness, urinary tract infections. All these are really common signs of low estrogen. So you can have periods. Sometimes if people are having happy periods and they don't want to have periods anymore, then the most obvious thing is to speak to GP about having the Mirena coil or having your HRT or your progesterone element of medication altered slightly so that you're less likely to have periods. But the Mirena coil is one of the better forms for giving you no periods at all.
Thank you. We've just to double check on the length of menopause then, if you're on HRT, then it doesn't make a difference to the length of the menopause. It's just the symptoms as you go along the journey, basically.
Yeah, the menopause fundamentally lasts about a year, the exact terminology. The first day of your last period is the day you entered the menopause. A year later is the day that you sort of end the menopause, if we're being very, very technical. We use the word menopause as a bit of a generalized term, but the peri is the period before. The perimenopausal stage is the stage leading up to the first day of your last period. And that's when you notoriously develop lots and lots of symptoms of menopause. That can last for years. It's, you know, who knows how long these things go. And the first day of your last period is the day you actually enter the menopause. A year later, I normally say a year and a day later, you're then being postmenopausal.
Thank you. So yes, that's very clear, and it's two independent things then, really. I'm going to, they've got loads of questions coming in. I want to ask you a bit more. When you were giving your introduction, you talked about the safety, and I know we were talking about the NICE guidelines then and the risk levels and evaluating that. It's a very personal thing. We've had quite a few questions about is HRT safe generally, and are there other options that are safer, like bioidentical hormones, or someone's read that vaginal estrogen is less risky? Could you talk a bit about the safety concerns in a bit more detail, and are there safer, in quotes, alternatives?
Okay. There's been lots and lots of talk and lots of research papers about HRT and it causing breast cancer. There were a couple of huge articles published, so like back in the 2000s, something like that, which basically they found a link that it gave you breast cancer. It's a very, very, very long story, and there's been years and years of research since then. So first of all, I'd like to say we want to put that one slightly to bed, because the research was done on older women that had predisposed factors such as obesity and smoking, and things like this, and high blood pressure. The older we are, the more likely we are to get any form of cancer, regardless of what it is. Whether you take HRT or not, your risks of developing cancer are approximately the same. So HRT won't necessarily give you cancer. If you do have some cancerous cells there, it can activate them. But then we have to think of, you know, what small population that is. The worst case scenario would be that a small percentage of women may get breast cancer from HRT. But the risks are incredibly small. There was an article that was published, if I can just briefly read this. This came out about 2 weeks ago. I can't quite think of the name of it. It was an American one, Journal of American Medicine, I think it was. It highlighted that estrogen-only HRT, they had a lower risk of developing breast cancer. But when you add estrogen and one particular type of progesterone, there was a higher incidence of breast cancer. But, and this is the big but, there was no significant difference in breast cancer mortality. So they did find there was a very slight risk of developing a breast cancer with an estrogen, but it's the type of progesterone that you have with it that's the most important thing. Okay. It can increase your risk of possibly getting cellular changes, but the chances of dying with breast cancer are the same, nothing. So there's no increased risk of mortality. And that's really important because people are always saying to me, it's going to give me cancer, it's going to give me cancer. Well, as all the evidence that I talk to people about is that you've got a greater risk of developing any form of cancers if you're overweight. You've got a greater risk of developing any form of cancer if you smoke, if you don't take any exercise. So it's about looking at lifestyle. You know, again, we're talking about that taking HRT could possibly lead to some cellular changes. But again, we've got to look at your health in general. And what you do have to think of is quality of life versus risks and benefits. If you're in agony with aching joints, you're feeling really quite low in mood, you've got a lot of weight to gain, you feel that you can't concentrate, your confidence is on the floor, your relationship's falling apart, you could say that your quality of life is actually quite poor. And hormone replacement therapy, what I find and what all the evidence says is that it improves your quality of life considerably. In fact, I spoke to a lady today and she said it's been her words were, it's been a game changer. So it's literally ticked every single box of her life, bar one area which we were dealing with in a slightly different way. But those were her words, it's been a game changer. She's been for somebody that suffered really quite badly with all the common symptoms of it. They were literally on the top scoring, whereas now she feels a different person. And so I think it's looking at it from the fact that the quality of life, improving the physical symptoms, and you've got greater chances of getting heart disease than you would ever have with getting breast cancer and taking HRT. Because hormone replacement therapy protects your heart like nothing else. And this is the one thing that in the population we don't discuss enough of. But all the leading health professionals, all the leading research are absolutely driven with trying to educate people that the risks of developing breast cancer from taking HRT are very, very small. The risks of developing heart disease are huge if we don't take HRT. So it's looking at risks versus benefits and thinking, and it has to be a personal choice of what you want to do. But I know what I choose, and I know what I prescribe, and I wouldn't prescribe something to somebody that I didn't feel comfortable and confident with what I was prescribing, because I understand how estrogen works and the roots of it. So this is the type of HRT that you get from your GP. And this is called regulated bioidentical HRT. There are certain clinics that people pay an awful lot of money to go to. In fact, I spoke to a lady recently, she paid £1,000 to go to a clinic in which sometimes they do blood tests, but often they do saliva samples. And they make HRT actually in the house. And this is known as unregulated, compounded bioidentical. So the stuff that you get from your GP and specialist health professionals that you get that work within the health service as such, they are regulated. But there are certain clinics that do unregulated, and unregulated compounded bioidentical is not something that the health professionals in the UK advocate. In fact, the British Menopause Society actually says in their literature that they do not advocate this, and other health resources say that it's not licensed by the UK authorities, and NICE guidelines actually quote in there saying that the safety of the unregulated compounded bioidentical, their safety and efficacy is unknown. So that for me makes me realise that I want to take something that I understand how it works and I understand how effective it's going to be. The HRT you get from people like me, and the GP has got years and years of research. We understand it. But other types of things, we don't understand it. I don't have a clue what's in it. I wouldn't know. But, you know, I would like to base things on what is safe and what I understand to be safe and works. It's effective. So I hope that helps. Has that cleared that question up?
Yeah, it's as you say, isn't it? It's weighing up the risks and benefits, and also the known unknowns as well. We have a couple of questions from people who have chosen to take HRT, but unfortunately they've noticed a few side effects from it. Now, what should they do about that? And I'll give you the examples that we've had. Hi, I've been taking HRT for a couple of months. Really good. Everything improved, in particular my sleep. Just lately, I've noticed my anxiety creeping in again and brain fog, feeling disoriented. Should I up my estrogen or look at testosterone? And another one saying, I suffer from depression. Since going on HRT, my mood has worsened to the extent of feeling suicidal. I'm on estrogen and progestin. I'm also having irregular heavy periods. So clearly, while you can make the best decision at the outset, there may be side effects. And what should you do to handle?
First of all, when you've been prescribed medication, you take it as it's been prescribed to you. So the first thing that you do is you contact your GP or the health professional that's prescribed it, and you would explain, I'm getting these symptoms, because it might be completely unrelated to the HRT you've been prescribed. So any prescribed medication should be taken as it's been prescribed. If you're developing new symptoms, then the GP can help address that with you. Sometimes it's the route of the hormone replacement therapy that you're taking and the dose of it. So for some people, it might be that they need to increase it. And I generally find that when I review people a few weeks after starting people on HRT, sometimes you need to review it and sometimes you need to increase it at that point. So just because you've been prescribed it on a certain amount of HRT, certain milligrams and things, doesn't mean to say you have to stay on that. Your GP will discuss that with you, and together you'll decide whether it's something that can be increased. And as far as the lady was saying that she's feeling depressed taking HRT, the big question would be is if you've ever felt like this before. Is there any history of any depression? If it's a brand new thing, then first of all, one, you need to talk to the doctor about it. And it may be that you need to think about the route of that you're taking the progesterone. It might be that you need to have that progesterone in a slightly different format, but your GP will guide you with that as well. But with all these things, you don't change your prescribed medications only under the guidance of the health practitioner that's prescribed it to you.
So go to your GP and explain what you're feeling and go from there. Thank you. We've had a couple of people asking, can you take HRT above 60 or, postmenopausally? When do you stop?
No, the big question is that you don't have to stop. It used to be that you would take it for a few years, but things have changed and moved forward. And it's the case, it's what I said earlier, when the benefit of taking it outweighs any risk factors. So I know people in their 80s that are taking low dose HRT because they feel better with it, they sleep better, some people get hot flushes up until their 80s, other people don't. It's really, this is why it is individualised, but there's no upper age limit. But starting it, the younger you start it, the better, because the deficiency symptoms that you're feeling are there. So that deficiency is going to continue until potentially if you want to take HRT, the deficiency would continue until you started on hormone replacement therapy. So the weakening of your bones, the cardiovascular effects by the lack of estrogen will be setting in. But you can take HRT. They say better within 10 years of starting the menopause. But again, that could be something you can talk to your doctor about. The earlier you start it, the better. But we do start women older on HRT, but it'll be just a bit more of a discussion and things like this. So it's not a complete no. It's about risk factors and things like that. But the health professionals could talk to you about that.
So interesting that there's some people who do take it for much longer because the benefits outweigh the risk. We did have some questions about, somebody said they've been taking it for 10 years, since the age of 55. It's been a lifesaver, no hot flushes, moods lifted, I can even sleep. My GP, however, wants me to come off it and says I've been on it too long, and that, combined with my age, is a huge risk factor. I don't want to stop HRT as I felt miserable before. Is there a max length of time, or is it it's the risk benefit assessment?
It's risk benefits. I mean, what I always advise people is talk to your GP and ask them why they think you should stop it. Because all the current guidelines are that you would stay on it if it's benefiting you, and you feel better with it, and you have no specific risk factors that the doctor is aware of that you aren't, then why do you have to stop it? Because you don't have to. I know doctors that are prescribing it for women in their 80s. I know women in their 80s that are taking it. So if they can have it, if they're being prescribed it, you don't have to stop it. But it's a question for your GP. And I would say, put the question back to the doctor and say, on what grounds do you say that I'm not suitable for it? Show me the evidence, show me the research that says I have to stop it. Because there's lots of people that recommend things, but the current guidelines, the current way of thinking from everything that I read and study, is that there's no upper age limit to it. It's all about the benefits and the risks, and talking to your health professional about that.
Okay, thank you so much, Diane. We've got a couple more minutes, but I can see about 10 questions, so we're not going to get to them all. I'm just going to say at this point, I'm going to take two more probably in the time we have left. But if your question wasn't answered today, if you go onto menopause.livebetterwith.com and go to the expert Q&A, then you can post your question there, and Diane will answer it in writing, because I can see this is such an active topic, and I'm really sorry that we're going to run out of time before we cover everybody's questions. So go to menopause.livebetterwith.com, and you can post your question there in writing, and Diane will answer it. So a couple of final questions, Diane. There's some questions around when you shouldn't take HRT. So I'll give you the couple of examples, and then maybe you could talk just about things to watch out for. So somebody said, I had a hysterectomy at the age of 35. It put me into early menopause. I now have all the classic symptoms. Can I take HRT? Someone else has said, I have my family history of ovarian cancer or cancerous cells. So can I take HRT? Are there certain sort of categories or things that people may have gone through that means, or genetically, that means you should just it's not an option?
Having hormone replacement therapy will be available to a lot more people than they think that can have it. Lots of people say to me, I can't have it because I smoke. My doctor says I can't have it because I've got high blood pressure. There are certain groups that definitely can. When there's a history of ovarian cancer and a history of breast cancer, it depends what history we're talking about and the age of the person when they were first diagnosed with it. If your mom was diagnosed with breast cancer when she was 34, then that potentially would give you a slightly increased risk. But it doesn't mean that you can't take it. Everything is about balance, and everything is about discussion. So nothing is off limits as such. It's something you really, really need to talk to your doctor about. Do a lot of reading about it, because if your quality of life is incredibly poor, but you may have slightly increased risk factors, it may be that if you lost some weight and stopped drinking and smoking and things, that your risk factors would come down, and actually it will be completely beneficial for you to have it then. So it's not quite as simple as that. So there's nothing that's particularly off limits. And again, if you've got an estrogen receptor positive cancer, so the estrogen, the cancer is being driven by estrogen, then having estrogen, of course, is going to make this worse. So that's the group that really wouldn't be involved with this, certainly at that time. But people that have had cancer in the past, again, it's about discussion with the GP. There'd be a lot of women that probably wouldn't have HRT and their doctors wouldn't prescribe it, and they'd be quite happy that they don't want it, because there are other things that people can have, and there are lots of other things that GP can prescribe you that can help with the symptom control. The one thing I just wanted to say before we end is about people saying to me that they've been prescribed antidepressants and not HRT. The NICE guidelines are incredibly clear about this, okay? HRT, not antidepressants, are advised. There's no, and this is the NICE guidelines here, there's no clear evidence that antidepressants help with low mood in menopause. All right, now depression is a very different thing, but low mood related to menopause, the NICE guidelines say there's no clear evidence that antidepressants help relieve low mood in menopause. HRT does.
Right. So thank you.
Clear things up.
Thank you. That's fantastic. That was another question, and it's great to have these myths busted. And also, I think you've got a really clear message. There are lots and lots of possibilities to go and have the conversation with your GP. And we actually had some comments from people on this webinar saying, when I went armed with, and not taking no for an answer, but going in and with the NICE guidelines, questioning them, knowing, showing, you've done a bit of research and wouldn't be fobbed off, and getting the answers and the clarity of whether it actually is an option for you. Great.
That's right.
Diane, thank you so much. I'm sad we've run out of time, because I can see 6 questions not answered and another few in the chat. So again, Diane is our, we're lucky to have her as our menopause nurse and expert. So if you go to menopause.livebetterwith.com and go to the expert Q&A section of the site, you'll see the forum that we have there, and Diane will answer your questions in writing. So please ask these questions and keep asking them, and we will definitely get you the answers that you need, even if we've run out of time right now. So thank you everyone for joining, and thanks so much, Diane.
Thank you very much. Take care. Thank you. Bye-bye.